So I want to talk again today about managing your list because that's the most important part of the intern job description. And it's so hard because you're constantly having new urgent things that you have to do. And to help my mind manage that, I adapted what's called the Eisenhower matrix. So if you imagine a 2x2 table, and at the top you have important and not urgent. And so then thinking of box 1 as things that are urgent and important. Those are the tasks that need to be done right away. So examples of those would be anything related to discharge, calling consults, taking care of a critically ill patient. And then here's box 2, which is non-urgent but important, which I'll talk about in a second. Box 3 is urgent but not important. And box 4 is not urgent and not important. For things that are not urgent and not important, there's a difference between submitting your notes, which is important, and having perfect notes, which is not important. Giving presentations about a certain topic, I'd make sure it's about something related to a patient or that I was already pretty comfortable with, so I wouldn't spend too much time with it and just surviving. Urgent and not important, like pages that have already been somewhere in the orders, or dealing with confused families of patients. The magic of box 2 is that the more you spend time building systems, focusing on box 2, it will reduce both the box 1 urgent important things. You'll more likely to anticipate what's happening with a sick patient, be able to upgrade them sooner, and also reduce box 3 type tasks because the nurses already know what the plan is. The family already knows what the plan is. And because it is then already part of your system and part of your workflow, you're less disrupted and can then move through the day more calmly and get more done. So what I like to tell med students and incoming interns is do your best whenever you have time to focus on box 2. A lot of that is learning their systems, such as what is the best strategy for talking to nurses? What are the best ways to write a good consult order so that the consultant is already ready to answer the question? They can give you the most effective templates. All of those things give you more time. And then I talked before about thinking like a resident. Those things will also reduce the amount of last minute urgent questions about what a patient needs for discharge or admissions. So a lot of what I'll focus on in other videos will be more detailed practical tips for these box 2 type tasks.